Hi everyone, Dr. Michelle Mion here. What we're going to go over right now is the concept of overjet. Okay, so this is a very common diagnosis that we find in orthodontic patients. Sometimes people come in saying this is an overbite, but I just want to go over the proper terminology for this. So if we're to look at these teeth, this white line denotes where the top front teeth are, and this white line denotes where the bottom front teeth are. Now that gap between the top and the bottom front teeth, with the top teeth being ahead of the bottom teeth, is referred to as an overjet. So if we look at the side profile of a person, I'm going to use a white line here to denote the top front teeth, and another one here to denote the bottom front teeth. So from this side view, we can see that this is our overjet. Now, if we're to move the bottom front tooth back, let's say because it's displaced, let's say because the lower jaw didn't grow enough, but either way, it's farther back, we're going to see that that measurement where the red arrow is, the overjet, increases. And we would call this something called excessive overjet. Now, there are several risks when we have an excessive overjet. One risk is that because these top front teeth are way ahead of the bottom front teeth, they're more prone to having trauma or fracture if you were to fall or bump them. Also, we start to have uneven tooth wear when we don't have the proper relationship between the top and the bottom front teeth. Now, what I mean by that is if this lower tooth was back where it started and we move our jaw front to back, that means those two front teeth are going to be touching, and it's a protective mechanism when they do. But if we have this large gap between the top and the bottom front teeth, we don't have that protective mechanism, so we can start to get uneven wear on our teeth. Luckily, there are several treatment modalities for an overjet or an excessive overjet. If we're of the right age, we can use functional appliances which help stimulate growth in the bottom jaw, braces, and in severe cases, we can use surgery to correct overjets.